It's great to be with everybody once again. Today I'd like to talk about some long COVID or long hauler success stories. We've been seeing in our clinic patients with complex chronic medical health issues for years. And with the advent of COVID, long haulers or long COVID patients have become a mainstay in our clinic. But these patients are very similar to patients we're already seeing. So what I'd like to do is just kind of talk about cases, patients I've seen, what we kind of have discovered about this process and how they got better, how patients with COVID have gotten better, how patients with long COVID, long haulers have gotten better, and ultimately to educate you all, are there things you can do if you're a chronically ill patient with chronic fatigue, with fibro, other chronic health issues. If you're a long hauler, what are the things you can do? If you have dysautonomia, what are things you can do to kind of actually help restore your health using science-backed therapies? So that's what we're going to talk about today. So I'd like to start with one of my patients that I'm working with right now. For those of you that follow us on social media, you'll know that we're actually getting ready to launch a community, a resilience community that's going to be focusing on helping people to take back their health in a community base with myself and my team educating people and leading discussions on health using the most up-to-date medical literature and data. And so this is an example of how this applies to an individual, so hopefully y'all will enjoy this. So this particular patient, I don't want to use real names, of course, but she's someone I've been seeing for a couple of years, know her fairly well. The way she actually came to me initially was she had developed really bad dysautonomia and POTS after getting breast implants put in. So we kind of started working with her and found out some basic issues with her health. She, was hypermobile, had lived in a house with mold, which is really interesting how that activates your immune system, and also had some personal trauma, personal health issues as well. So over the last about year and a half, we've been working through a lot of those things, and actually got her dysautonomia into remission, her chronic fatigue and fibro mostly in remission, and she was actually to the point where she was able to go to college. When we started working with her at the end of high school, there's some questions whether or not she would actually be able to go to college. So went off to college last year, and this year she got COVID this past summer. So what happened was she started to experience really bad shortness of breath. Her dysautonomia came back, her fatigue came back, her pain, which was something that had been gone away. All this came back, but it was very acute. And so because we'd been working with her, we knew a lot of her pre-existing triggers or things that kind of set her up for inflammation and illness. We were actually able to reinstitute some of those things into her health. But at the same time, with the flare of this acute COVID, I knew to institute several interventions like N-acetylcysteine. We started using high-dose vitamin C, as well as Pepcid or famotidine, because she also had some mast cell issues. And so we were going to institute those things. Acutely, we were concerned about her having clots in her lungs, so we had to get CAT scans of her lungs, did oxygen levels, blood testing, and she did not have any of the markers of severe COVID, which was good. So able to track her through. At about 4 weeks out, she was feeling better, but still had the really bad shortness of breath. The pain was still there, but she was improving. And we add on resveratrol, which is one of the things that Institute for Functional Medicine put out in their white paper about some ideas to treat the inflammatory phase of COVID, acute COVID, as well as long COVID, what we call it now, or multi-system inflammatory syndrome. And that worked really, really well for her on top of all the other things we were doing. Saw her back in the clinic about 2 weeks after that addition, and she actually felt better than she'd felt before contracting COVID and developing long COVID. So her absolute symptoms of the post-COVID, long COVID, fatigue, dysautonomia, pain, brain fog, that stuff lasted about 6 weeks. The good news is we already kind of knew some of her triggers before. She had mold triggers, so we reinstituted some of the mold treatment. We realized some of her food triggers, so we reinstituted some of those things. But it was really nice to see how quickly she responded when we already knew some of her underlying conditions, how quickly she responded to the treatment. The other thing that was really interesting about her case is we were using all science-based solutions, science-based, research-based, article-based ideas to address her individual health issues. This was truly personalized medicine, individualized whole body care. And so it was really great to use that with her. So this is our first case. I know that there's a fair amount of long COVID long haulers out there. I think this is also interesting if you're watching this on YouTube, maybe to just kind of share your story, because that's one of the ways I learn is reading people's comments, people sharing their ideas with me, and we learn about how differently people are responding to this, and how some people are figuring new treatments. The next video I'll talk about a different patient, a different way we addressed some of her issues and how she responded to those as well. So y'all take care and be well.